About 537 million people worldwide have diabetes. The total number is projected to rise to 643 million by 2030. Hopefully, you're not part of the statistics.
He is currently a Professor 1 in the Department of Medicine at the UST and the head of the Diabetes Center at UST Hospital. He is also the present chairman of the Philippines Specialty Board of Endocrinology, Diabetes and Metabolism. He is currently affiliated with UST Hospital and St. Luke's Medical Center, Quezon City. Without any further ado, now let us welcome Dr. Sjoberg Ang Kho.
Thank you. Good afternoon, everyone. We're going to talk about diabetes. So, as you know, may kakilala pa tayo. Ay, kukunti naman. Oo. Okay. Hindi natin tatanungin kung sino may diabetes. We'll just focus on the topic. And it's an important topic kasi lahat tayo may kakilalang mayroong may diabetiko. Okay? So, next slide, please. So, we're going to talk about diabetes, what's causing it, how to prevent, and some of the complications. So, I'll talk about it a little bit more. Okay? Next slide, please. So the outline of my talk, nang kina Sjoberg Ang Kho từng do quý quan, dan causes or risk factors equated equated. So we do have modifiable and modifiable risk factors. So the non-modifiable, there's nothing we can do about it. But we'll teach you and learn about what we can do to prevent diabetes and its complications. So we'll talk about a little bit how to manage diabetes, and at the end, a little bit on complications. Next slide, please. So ano bang diabetes? Tanggapin siya. Okay, so next slide. So in the olden times, 定買較早一個最甜啲哦，定買無辦法能驗糖啊。好，咱 over the past 100 years, the technology changed. 我能到枕頭啊，就在邊啊，定兩個醫生個糖尿是甜的。Next slide。上個我能糖尿病啊，大家人有法得記，徛喺美國就有最精咯，嗬。你若講說用嘅糖尿病個，伊若看到你是亞洲人哦 ，they will identify you as high risk. Okay? What we know is if you are an Asian, you will develop diabetes at a smaller weight. So 亞洲人無欠嘢大個會得到糖尿病，過去啊大家大個就會得到糖尿病。亞洲人會得到糖尿病較少嘅 ，so at a younger age. So nowadays, 老那咱喺菲律賓個，有最人有糖尿病哦，20幾歲、30幾歲嘅也早就糖尿病。好，所以亞洲人特別較高就糖尿病。Next slide, please. So let's talk about what glucose 糖無完全是歹個，咱減糖啊，糖是咱嘅身軀嘅壓縮鏈啊，咱車無壓縮鏈袂走，但係即有 electric car 咯，就你最插電就走咯。好，in the olden days when we use gas, so we look at glucose. It's not always a foe. It's a friend. It's part of our body, and this is the reason why. 咱就食糖，那講嘅pag mababang sugar, you feel really weak and you couldn't think, and you feel lousy. 好，人無力做哪瞓咯，結果 so it's like 一等車，你若無教訓練就袂走咯。啊，咱糖也袂做講啊，也係歹，好。唔過糖啊，就貴，但係佔住咱嘅血管嘅個，有最 side effects 咯，好，有最 complications. So next slide, please. So what is insulin? insulin 是看咱基础是啊，好，咱的身躯个若无胰岛素，糖定定伫浸伫咱的血管，无法咱入去咱的身躯咧做insulin。Okay, so if we do not have insulin, what happens is the glucose will stay in the blood system, and then nandun lang siya, nakababad sa blood vessel, hindi siya nagagamit as source of energy. So, napakahalaga ng insulin as part ng body natin. Okay, next slide please. So, saan ang galing ang insulin? Mamaya pag-usapan natin. So, we need insulin. It works as a key, so si kui mang, kui cha, 糖叫我们入去身躯咧，当然用做para靠力用，哈。So it's a source of energy, but it's like we need the doors to be open. We use insulin as a key to open the door so that glucose can enter the cells to be the source of energy. Next slide, please. So what happens with normal people? Normal people, you have enough insulin lan uso si kui mang, ha, kui so, kui嘅時陣。糖入去咱身躯咧，可能做咱的 source of energy， 所做咱的力量个吼。但是糖尿病有两款大项的问题，吼。in some people 有人较大问题是伊肠咧哦出无够胰岛素，你若无胰岛素就无锁匙咯。You don't have a key, so the door won't open. But the other problem is，别人的问题是。都有鎖匙啊，但是話所講，每一個門哦，幾六天鎖，伊特別門特別較艱苦開，好，所以以為鎖是德國做嘅，唔是大陸做嘅，大陸做嘅也好開哦，因為德國做嘅也歹開個嗬，所以呢是一個項問題，所以糖日日佔住嘅血管咧就冇能入去個。Next slide please. And 咱有兩款，吼，頭一款是個第一級的哦，Type 1 diabetes。第一級是較種出來較少些，所以咱若有一個300的，其他就有得糖尿病，也無10歲得糖尿病，所以較種是Type 1。And 因在個因為超個無可能拍鎖匙啊，胰島素哦，差不多是空，所以在細項其他個陣其他哦，就拍針拍胰島素無袂活啊。好，因用嘅若無個糖，無能入去身軀嚟個，常會活牙久。所以定擺用嘅胰島素發明是100年不人。好 ，insulin was invented about 100 years ago. Before that, if you have type 1 diabetes, within a few months, the kid will die. 好，所以見啊定擺100年，較早100年前個。無胰島素個，你就這個第一級嘅個發現啊，無幾做那無幾禮拜無幾個月哦，會改變咯，會話。所以因頭發現咗胰島素是用狗嘅腸，推個狗嘅胰島素拍咧一個囡仔，即係個囡仔活差不多幾十年啊。唔過狗嘅腸嘅 insulin 叫咱人嘅 insulin 無上過，所以有做那嘅 side effect 啊，嘅 allergy。So 2 years in 從這個用嘅辦法，點 laboratory 嚟個出 insulin 叫人上咯，就較無問題咯。So it used to be in the past they started with using dog insulin. When they first discovered insulin 100 years ago, they were injecting dog insulin into people with type 1. And then after that came beef, then pork insulin, yung 牛叫啲胰島素比較無 side effect， 較無反應。落尾就 siyempre the technology improve, gumaling na ang paggawa ng insulin sa factory na ginagawang insulin, nagaya na yung kung ano itsura ng insulin ng tao. So nowadays, yung insulin na sila saksak sa mga pasyente, these are very similar to human insulin. And so therefore, less side effects. Next slide, please. So type 2, I think most of this, di daw糖尿病，呢個這個血脂2或者幾以上個是第2級嘅。在第2級嘅個腸有較無力淡薄，但是無完全歹去，所以若果有出淡薄胰島素，有陣啊出無成夠。 较大问题哦是怀门哦，也做偏疏，也歹开。好 ，so the problem is insulin resistance. So in type 2 diabetes, they still have some insulin going on, being released, not absolutely zero. So, but not enough to overcome the locks that are hard to open. So, yung mahirap buksan yung mga pinto, yung mga kandado, para so therefore hindi makapasok yung sugar sa katawan ng tao. Okay? And maraming risk factors, Next slide, please. So,咱讲淡薄，咱咧知影讲说咱是有糖尿病啊，好，ano mga sintomas ng mga may diabetico? Next slide. 大多數個頭頭是無發覺半行，你唔知影有糖尿病，你若無逐年去驗血個，你唔知影有糖尿病。在咱咧講嘅個，看你會什麼發覺個，主要是較晚嘅咯，你糖尿病啊較懸哦，即係淡薄在發覺到一個代誌個嗬。So one is frequent urination. So sa umpisa wala kang maramdaman walang sintomas ng diabetes. Pero as it progress, pag lumalala na siya, doon pa lang lalabas yung mga sintomas. So hindi totoo na wala akong naramdaman, wala akong diabetes. Karamihan na may diabetico sa umpisa walang naramdaman. Okay? So iti-treata, palauhaw, kuidit-yaw, kasi di thang hoài số phải khui cái là chính trị hoài huy quân này có bộ đặc khí sinh cụ này có đi lô年代啲bộ咧食無夠疼個，一直想要食，好疼到咧規安，你個規日咧一直有，好 ，and then 有陣啊，你若無能用糖做牙術練做 energy 個，你開始用你嘅肥嘛，叫你嘅身軀嘅食嘛，所以陣啊，懷糖尿病或甲靠一擺叫人一直瘦啊 ，OK。伊消散的時陣，個即知影講說無辦到糖尿病哦，好。And then also other symptoms can include poor concentration, 佢哋愛困把 ，OK， 目睭部，有可能那破傷會較你目喙較笨，好。So but some patients will say, hindi, walang diabetes. Pag nasusugatan ako, madaling gumaling eh. Okay? That's not true either, okay? Ang katotohanan, pag may diabetes ka, it's true, mas mabagal ang paghilom ng sugat. Okay? Pero hindi parati. So, huwag lang isipin na, may lahi kayong diabetes. Pero pag nasusugatan, madaling maghilom yung sugat, ibig sabihin nun, wala kang diabetes, okay? Hindi assurance yun, okay? Di singko, yung siyong kao na, 目喙也緊哦，無拄拄講說你無糖尿病，吼，你到一個程度，pag grabe na yung diabetes, then maybe mabagal ang paghilom ng sugat. Okay? Pero sa early part ng diabetes, walang simptomas yan. Okay, next slide. Okay, kung wala tayong simptomas, so sinong dapat ma-test for diabetes? So lan bo wakak mo po ang ko tan si siyang ato kigiyama, di糖尿病。較上，你若40歲以上，你雖然無家庭無像糖尿病哦，你身軀無代志，無感覺啥哦，你若40歲以上就去驗啦，好。And there are others, for example， 你頂擺或別人帶先，你這捌聽見後帶先會着糖尿病，了因生了會好起個，或者帶先人會着糖尿病嘅個，因到一個歲子哦。較大機會變做糖尿病，好，大多數或者帶先嘅會着糖尿病，但是你帶先，恁講恁新婦，恁查某仔想有糖尿病，帶先則着糖尿病個，生了糖會去再講，但是10年了後，有大機會你着糖尿病，同較早點。And people with 前邊你較體重若較懸，較大機會會着糖尿病。好 ，so 牛隻無體操，好，體重較懸，會較高着糖尿病。其他別人也是毒氣。So，可是the other cause, what causes diabetes to come out can also cause risk for hypertension. So, it's not the high blood that causes diabetes. Hindi siya diretsong effect. Kasi kung yung high blood ang nagkakos ng diabetes, pababain mo yung blood pressure, dapat mawala yung diabetes. Pero hindi. Pareho sila ng risk factors. Kung sino yung at risk for diabetes, sila rin yung at risk magkaroon ng high blood. So, una-unahan lang, kwa to sige swing suit ah. Ni thang dio pi lang akagaw hiatap lang akagaw thang dio pi. Upalang thang dio swing suit palang si hiap swing suit. So, di nào hiatap lang di có cơ hội去就thang dio pi啊，就達到啊經驗個。有啲本不中風啊是心病 ，people with heart disease or stroke. These are the same risk factors that might lead to diabetes. So those people with heart attack should be tested for diabetes. Routine yun. Kahit na wala silang ramdaman, nagka-stroke sila, nagkaroon silang heart attack, kailangan nilang ma-test for diabetes. And also people, sim yu kui, hoi yu ke, at ito, check for diabetes. People with high triglycerides and low good cholesterol, which is HDL, should also be tested for diabetes. Next slide, please. So, let me draw the line to your pia. To keep yam no. Ni dong to keep tao cheng tawa bo chun. So, yung ginagamit natin sa bahay, kung tayo makigamit sa loved ones natin, yung sa daliri, hindi siya accurate. Yung mga para sa daliri are designed for convenience. Para kadipin. Bo chin chun. So, lan tao cheng tawa bo zui yang zui gong zui zui piao chun, gong zui yu teng yu ping. You have to go to the lab to be tested. Yan yung pinaka-accurate. Okay? So generally, when we say fasting, dapat hindi ka nakakain ng 8 hanggang 12 oras, 8 to 12 hours of fasting, and you get tested. If your sugar is lampas sa 125, meaning 126 pataas, then you should suspect na may diabetes. According to Teng Dioping. 廿八杯就差不多就糖尿病咯，唔管差不多，我做那83咯，83個 ，not that high, 130 or 135. Probably you need to be tested again kasi laboratories can make mistakes also. 做那無準個，你嘛就做那驗單，所以你超過淡薄個，你就無辦法加減啊。這個也重要啊，你若唔是超過廿歲，我就加減，你為咗。Gun也斟酌公司，盲叫人糖尿病。If you label somebody as being diabetic， 你叫別人家公司有糖尿病個，而且那邊買保險個 ，health insurance or life insurance，they are gonna be charged more。因為糖尿病嘅人較有看病，較有入病處。So they know patients with diabetes have higher complications, probably will live shorter. So therefore, insurance companies, for them to buy insurance, they'll either be rejected or if they get approved, they have to pay a premium price. 好，我做那嘢講即係做啲糖尿病嗰個俾人哋保險，啊，因那人哋保個，你就係先俾睇啲，你逐年別人把啦，一塊就把啦2塊，好，因就係先冇了錢啊，好，就咱度嗱小花貴，咱加減者較斟酌，好 ，OK 啊，我做那飲糖水。亦叫你這類等能點整 ，so glucose tolerance test. If you go above 200 or higher， 200以上，這個是叫做糖尿病。好 ，next slide please. So，為斷咗啊，namaman ang diabetes. Okay, so people with relatives, first degree relatives, okay, hindi na hawa ang diabetes. So wala mong din ka mo siya ang糖尿病，唔冇糖尿病啊，唔冇。冇有啲關係，冇班ang relationship niyo is maybe poor eating habits, yun ang pareho sa asawa niyo. Pero hindi yan nahawa na mamana. Pero nakakahawa ang kumain ng marami. Okay? Kasi masarap kumain. Okay? So what will put you at risk? So we said there are modifiable risk factors and non-modifiable risk factors. 有一個會過得，有一個袂過得，好，咱要怎啊袂生糖尿病啊？唔過一個袂過得，咱也無能規講說咱要生去到什麼啲啦，對嗎 ？So we cannot choose our parents. That's non-modifiable, but we can choose to eat healthier. 咱會做食較少咧，好，咱會做較減肥咧，吼。 茫点烟 ，OK， 茫食伤多，运动，allow aging there's no cure, non-modifiable， 大家人会老的，好，咱这个袂过的，所以咱要生咧什么点，叫要较济的，这个袂过的，但是咱日日要食啥，要运动，体重要偌济，全是会过的，所以 we can to a certain extent control, delay diabetes. Next slide. So, why do we care about diabetes? Ba't tayo nandito at pinag-uusapan ng diabetes? Kasi napakaraming taong meron yan at napakaraming komplikasyon. At lahat yan, dapat naiiwasan. 所以避免啲好，所以 complications 心病、中風、好卡冠、咳、目睭、天面、腰子、叫卡手吧。所以你糖尿那较早发天嚟個，佢控制較好些嚟個，所以當日會發生，所以 complications， 所以避免啲，是會前啲，咱也無法能避免，所以就好似前咯，對吧？所以搞嗰些藥劑派去，你前5年、前10年嘛好，好，所以藥劑未所以即啊，咱啊前嘛是無也艱苦，你所以藥劑一禮拜3。都去3個 ，OK， 每一個4點鐘，所以開車1點鐘去1點鐘來，你唔能衝半行咯，好 ，so we would like to delay these complications, prevent, if not total prevention, is to delay the development of these complications, and that's why we care about early detection and management of diabetes. Next slide, please. So for So next slide please. So 目睭嘅刺耳個也最聽到，你問等啊，呢度糖尿病嘅人個，問等目睭部就俾睇醫生哦。因在咧醫目睭嘅個，因有辦法得甲你牙渣甲你驗掉。So if you have diabetes, you have to go to an eye doctor very early. Don't wait until that you have blurring of vision or you feel something. It's probably too late. 好，上幾晚咯，你嚟見目睭部咯。所以就大大話去驗，好，這個也重要，好，問想開錢要錢，咁麻煩，都掉你 battery， nawawala na. Treating complications much more expensive， 好，你若讀去laser，讀去手術目睭，也麻煩啊，個也貴啊，你要做那半工落去找目睭醫生，好，就去驗。Next slide please. So， 所以藥劑嘅，咱就凊彩去 any dialysis center， 做咧所以藥劑哦，哪開也最驚哦，干哪隻即 medical science is very good。另外啲呐，就講識到所以藥劑哦，活袂久啊，即也最藥哦，即個 science 也好咯哦，你也那就藥劑派去到所以藥劑哦，會活也久咯，好。所以，因若活久個，你若活袂久，一年，你都無欠免開也最驚嘅，你水藥劑嘅，好，你在活久嘅時陣，哪來哪欠無夠，佫開。Number one cause of dialysis in any dialysis center is diabetes. Number one. It's not because you have high blood, not because 你身上有啥物藥劑病。第一原因咧水藥劑是為着糖尿病。唔是糖尿病無照顧，你若照顧就不會水藥劑，當然是袂水藥劑，你有照顧。懷咧用嘅是 either 也晚發現有糖尿病，因發現嘅時陣藥劑已經着掉咯。OK 啊，但係糖尿病就無去照顧，就直接會着掉咯。好 ，so next slide please. And 手卡手吧，你買嘅時陣我拄着病人哦，也去病厝嚟個哦，你燒，坐來坐去無半項病，攤開時陣個直接單啲嘅卡嚟個哦，所以唔知。The numbness can be very severe, so much so that they don't feel their feet. May sugat na. So every patient with diabetes should check their feet before they go to sleep. 好，你有糖尿病人，要看啲腳看有傷無？要看啲腳底看有傷無？逐日，咱知影講說，伊若着 back infection mas mahirap gamutin eh. So you have to treat it very early. 問講說我看一禮拜咯，你看到有傷咯，已經咧紅咯，我看一禮拜咯，咧拖偌緊呢？But we have seen patients from small lesion, kaka-delay, sige tingnan mo natin, papahid na kung anong bibili ako anong pamahid, delay, alam ni Christian tsaka ni Jason yan, mga surgeon yan, sila yung tagaputo ng paa kapag hindi umabot, okay? Not anymore, but ayan, yun ang kasama sa road nila. Yan ang example, okay? Ito yung mapuputo yung paa niyan, nagkakaliwa. Yung kanan niyan, tinago ko na. Kasi yung paa niyan, putol na, nakahiwalay na. Kasi pangit naman kasi baka mag-gross out kayo eh. O, then, kung ay chopping, ikaw iking kilay lo. O, iking nakahiwalay na yan. So, ka to chow ko. Okay, for example, I'll teach you ka betong a chow ko. Para wo ki yong eh. Siyempre, tang to ko ka hose le, ha? You have to keep your feet dry. Na bitching mo ito, chit katale. Boy, sinichiya. Magkakaroon ng alipunga eh. So, pag nagkasugat yan, magka-infection, pag kumalat yan, may chance umabot sa ganun at maputol. Okay? Sapatos. Always buy half size bigger. Yes, yung ko, nagpapaltos yung paa. Nasusugatan. Leather shoes. Yasu yun di way, kung kami kanchuwa, boy ki boy sin way at siyang, way tanggalay paltos yan. Ni mang hidi siyang way, way tuwing ko, may break-in period yan pag mga balat na sapatos. You have to wear it for, palambutin mo muna. Okay? And yung mga women, try not to wear high heel shoes. When you cut your nails, cut it straight, not too short. Okay? The way it will grow, inalihwat ya sichon ko, curl. So, curl ya sichon ko, din like ko, sakle di maale. So, di na ka di tsuyin ka to ka pitit. The corner you just file. Ano sa Chinese yung file? Kikil. Ano sa Chinese yun? Tagi kwetang po, di yung kanto. Pero cut man cut shoot, ang cut straight para inalihwa to, it will expand like this and not won't curl up. Okay? Next slide. So, kinahanglan teacher 就是要用喺度，可是有一條大字咱規日講袂了啊，同咗先，那俾我嗰邊咱見下記咗我淡薄。Next slide please. So 咱度帶人度邊邊，呢度同咗邊呢個邊邊方式，跟下呢度兼隻度運動度食啲嘢嚇。So 同咗邊嘢好喂，暫且 the medical science cannot cure diabetes yet. Okay? Even for type 1, yung concept transplant,冇夠嘅 science to really cure diabetes. What we can prevent are the complications. Okay, next slide. We know about diet. Okay, so kim chả có kê cho kim, kéo thể tăng mang xương cái bụi. Next slide. And nãy hết chả có hả? So what phổ thông là lấy cấp gì? Nhân biết kim họ nhau thường được go hàng tế. I whites that will raise your sugar. The very first one is sugar. Para ka okay nila. Pinaka ko siya, go hang te brown sugar ito yo. The white is just for you to remember. Okay? So people will say brown sugar pwede kasi sabi mo white eh. Okay? But it's for you to remember. Sugar, okay? Number 2 is rice. 3 is flour, mihun, B, mihun, then starch. Starch okay, and then potato. These are the 5 whites that you probably don't eat a lot of. They will be converted to sugar. Okay, you can eat all of them, but not too much. Next slide, please. Exercise. The recommended exercise is 30 minutes per day, 5 days a week. 一禮拜差不多150分鐘，每一日30分鐘，一禮拜到5日。袂做講說拜日，我拜一到拜六做是無用。拜日150分鐘，仲要積積咧做一個運動無長，呢度係 spread it out. You have to spread out the exercise. Bawal yung weekend warrior. Next slide please. Okay? Anong pinakamagandang exercise? exercise that you like doing. There's no one exercise that's better than the other. 我叫你去走，我袂做哦。我人带一人咧夹人咧，我无能走哦，对吧？叫你游水，我人无游水滴，对吧？ So you don't have to go to the gym. Just do something what you like. 即係忙嘅啊，做喺 YouTube 咧教人順包，你就點出嚟嘅 exercise 咯。Okay? So do something that you can do, you can maintain, and you enjoy doing. Next slide. So 咱嚟運動就點有夠水，好 ，don't get dehydrated, right? That's not good for the kidneys. Next slide, please. And other rules that, okay, we already talk about how to take care of your feet, okay, to a certain extent. Next slide. And 有最寬，即係 10, 15 years, this past 10, 15 years, 有最新嘅藥啊。我頂擺頭咧讀做醫生嘅時陣個，胰島素一兩款，藥丸兩款，即係有最寬咯，好，有最寬。There are really good medicine. Really modern medicines are really good. 即係發病嘅有最寬，藥也好咯，好。Next slide. So the questions asked, ito yung dahilan, but wala kaming hanap buhay sometimes. Nakikiinom na lang nung, hindi siya, what day di siya, Pinamang kan na inaan niya, wala sa kwan niya, ito sa kwan niya. Kulang singko tayo si bosang, no, di ba? And that's why you need the expertise of a doctor. Say, there are medications that causes weight gain, utang dioping, tang di katang. So di saan na lang kung nagkanipai yung tang di ka itang. Di na cintua ko lang kung nagpai tang di yo, tang di ka san. So some of them medications causes weight gain, some of them are weight reducing medications for diabetes. And then when it comes to injectables, mga insulin, napakaraming klase na ngayon. And each will be different. There are medications for diabetes that are particularly protective for the heart and kidneys. 即係有一個較新式嘅藥，糖尿病等你降糖，嗰個保你嘅心叫保你嘅藥脂。所以你若本有心叫藥脂病嘅人個，你嘅藥叫為普通無心病、無藥脂病嘅人無生。所以 it's not one size fits all。到睇醫生 ，and there are more medications coming。OK， 有最新嘅藥要出嚟吧？你若無去找啲醫生個，你原在一直食壞藥個，有一個新藥較好嘅藥個，你說無能食，可是你無去找啲醫生。好 ，OK，next slide。OK， so next thing 啦 ，OK， 我們超人嘅藥無生，個人嘅辛苦無生。Next slide。OK， so 咱這焦點，袂做講說有啲點，有仲有無位，仲有袂記點，就焦點。And next slide. So make sure you take your medications correctly. And this is just an example of many medications. 有一個是咧醫藥劑嘅，有一個是醫肝嘅，頭腦手也最款咯，即。我哋近日配合看什麼較合理個，等你控制咧。但係我說糖尿病呢個 technology is really advancing really fast. Okay, next slide. So there are a lot of technology going on right now. So next slide. 即係有一款hindi ko yata dala yung sa akin eh. May kabit ako niyan eh. Nandito nakatago. Yun lang ko tao dyan tawa no. Di kabit cái PE ko, cái đuôi chiếu cái PE ingé ko, tu đi chặt gỗ đi, bỏ tao dần thầu à đi uế đi hông ấy đi thập chẳng phải phải chúng ta chặt cái tiền uế này đó, hả? Như là xin sắc cái tiền uế chúng ta chặt lo. Next slide. So there are many ways to monitor sugars now. And generally, 咱會通過要裝些怎樣或者控制何些是無啊？你未食過最好是80至100哩，好？那食飽了最好望超過100倍。但是你若較做迄個，阮會較理念淡薄，較無安尼發炎。做咧驚個你真做迄個吼，有陣啊你若想去驗哦， 糖才讲伤低个会多。咱若少迄个你小发糖咧讲起小方向所以徛咧走去走口食个。你若啊做迄个廿揽个，有阵仔会多，袂到走卡咧仲啊多咯，去跋时间去拢着头也做代志。So, and another reason why you need go to see your doctor. The targets for blood sugar and blood pressures are different. Kinasi for senior citizen, di ba? Kinai lecture. So, niya chow ke 70歲叫你 below 70, guna 醫法無常恁。可是也驚講說講傷嘅，你講傷嘅，有陣仔會入病厝啊，會生代志啊，咱無用喺度夾度注意恁。Next slide. Next slide. Okay, so we're gonna kind of summarize now. 咱差不多要講掉啲啦，嗬。頭一項就知影講說糖尿病就去驗，好，然後有做人較大個，好，有一個 symptoms 就去驗。第二項知影講說有糖尿病咯，就照顧咯，咱就食就趕食，體重就一個差不多，就運動，好。就明白糖尿病是干那是重要，好，咱就去學，看什麼干那是糖尿病，也做會較有生病，會較有中風，有一個藥有可能避免咯。啊，那醫生派藥，咱就照食，好，就達到去驗。糖尿病唔是講說派藥了你好說就是只有會變動啊，好，糖尿病也緊變動啊，咧跳高跳低也緊，好。So next slide. So I think these are the other targets. We'd like your blood pressure below 130 and 80 and stop smoking. We'd like your bad cholesterol to be less than 100. So 咱油也最寬，有好油、歹油。So 陣仔看到去也最負十五哦，無度都是歹啊。你若負十五是你嘅好油貴個哦，這個是好嘅代志咯，好。唔過啲負十五自己歹油咧就袂做啲咯，先灌攞固定較夠突，好。And next slide. So this is what we want. OK， 咱今日咧講糖尿病啊，咱頭一項講要愛活較久咧，好，活較久咧都無路用啊，你身軀就破病，因為身軀嘛就鬆，好，你活較久，譬如你欠一個骹，你活較久，譬如你逐日咧睡。一禮拜就水3晚藥劑，伊個 quality of life 較無好咯。所以咱愛活久，也是愛身軀鬆吼，唔通有 complications， 唔通入病厝。Okay? So I think that's the last slide. Thank you very much for your attention.
Thank you very much, Doctor. Before I ask question, when asking you din, mong question ko di ay mong Dr. Sjoberg ko, siyami ko, tan na din bo be mong loko, asi, wakam kakutyong yaw, di mong Dr. Sjoberg ko, what's a mong, what ito na asi, din niyo din siya nga ay mong muna, siya nga kachu muna, siya nga ay mong ah. Kasi di na bo lang, be mong go, be mong na lang. Upo ka, walang be mong mo.
Oh, okay.
Have you tried AI technology now?
AI. How do you say AI in Chinese? AI 是在電腦較貴嘅。I don't know how to say AI in Chinese, but you know what artificial intelligence is? 這也做啊，糖尿這種有啊。就是我這陣咧驗嚟講，好，你驗嚟講哦，一個叫我有第一級嘅咧拍站嚟講，可是有一問馬緊哦，你唔能一日年個拍也做咪咯。So there's a machine called what we call an insulin pump that will inject insulin to your body. And now the technology, 這個咧讓 Sjoberg can talk to the pump and tell the pump.For example, di thang letang ako, your pump shut down. For example, your sugar that's detecting, you don't have to prick your finger, even when you're sleeping, and the pump is pushing insulin into your body. this one technology will tell temperature 是有就是淡薄 AI 马紧就是你个创一个 settings 个方式，你调到这个甜度个，也总要 shut down to prevent sugar from going too low. And there are more. AI 也厉害啊，就是它it will replace a lot of work and jobs. Maybe some doctors, okay? But we are using AI. We are trying to learn AI and how to use AI to help our patients. And there are a lot of use for it. And 这阵有一款种 skin cancer 個 skin cancer 個 in 合200個相當一個電腦看個，這個是 cancer 是唔是啊？ And compared to dermatologist 皮膚或者專科醫生皮膚嘅 the capability to identify cancer is the same. The computer can identify melanoma equal to what a dermatologist can do. And there are and a lot of people will not have work in the future. 是位話咧話 grab 啲無蝦米車頭咯，再就買嘢無頭咯，好。位 financial analyst 話你講些股票上面嘢買啲，上面買啲個後尾用咗是 AI 咯。Yes. We have a question here. I'll repeat the question. If your sugar is 121, do you start medicine? So, I said fasting sugar is 126 and up. Starting 126 and up, that's diabetes. And what's normal sugar? If you ask me, it's less than 100. Okay? Less than 100. So, below go, so how about 100 to 125? That's pre-diabetes. Di po natin unak na. Yabe drinking tangyopin, pero di ba jinsyong? Dito注意咯。Dito pre-diabetes pa diabetes di po natin unak kayo to chayo. Well, that's a question. The answer is depends. To say one criteria is di pa diabetes ko, di tuasin na si chun ko, di tangyopin ko, dito chayo lo. Di way huli nang tuasin na si chun utang yopi ko, siya boki ko, isa kay siya huwan na yabi chingin tang yopi ko, di po atong nakla ko, that's a predictor, they will become diabetic. They will progress, almost sure. So those type, you have to take medicine, kahit na pre-diabetic. Yung mga nag-diabetic ko na habang kay buntis, okay? Pansamantala, gumaling ka, dumating ang araw na nag-121 ka, yan yung tanong niya kung kailangan uminom gamot. Yan yung isang situation, you have to take medicine. If nag-start ka, 110, next time 115, next time 121, alam natin kung saan ka papunta, tsayo din. O kaya people who are very heavy. So for example, you're 121 and you don't have diabetes during pregnancy, I won't give you medicine. I'll just ask you to exercise. Diet, I don't think you eat a lot. Yes, it depends. Utunan to chayo.
Ikaw tong siyong ko na isang dali reseta for diabetes, which is the metformin. Ikaw ko, sige metformin, tao ti tuhige lang pay asibo pay. Diyaw sa ko chitsu no, waya tsoy, kaya lang kong tiway ko, para inay siyaw-san ko, hindi siya ay metformin, pero iya sugar boy ako, isi ay san lang. So, sige metformin, tautin si side effect mo.
Okay, so metformin has been around for 70 years. And if you look at the guidelines of diabetes expert, come up with practice guidelines or recommendations. Metformin is always part of the first couple of medications that you have to give. So think about it. It's been around for 70 years. And whether you go to Europe, Americans, Philippines, Japanese, metformin is part of the guideline for treatment. Okay? So how about, is it bad for your kidneys, bad for your body? That's a lot of chismis. Okay? Fake news yun. Okay? So why would experts, these are not ordinary doctors, these are diabetes experts, would recommend metformin as part of the first-line treatment for diabetes. And metformin is cheap. Chok niya metformin, lalo na generic ones. And so, yan yung ano, so yeah, it's not true. What's true, however, is di yochi na yabolat loko, pag sobrang hina ng kidney mo, hindi ka pwede mag-metformin. Kasi hindi na kayang i-process ng katawan yung metformin. Di yochi na bokaulat ko, yung metformin ko, i-etetyao ulit, i-singku ulit. So, i-buwetso-iyang ulit. So, maybe people relate kasi bawal siya pag mahinang kidneys mo kasi hindi na kayang i-proseso. So, ang na-pick up ng mga pasyente, bakit ang metformin para sa kidneys? Kasi bawal siya kapag mahinang kidney mo eh. So, actually, metformin helps prevent kidney disease by controlling sugar. So, metformin in prevention of weight loss, not very effective. Okay? Some people, karamihan ng umiinom ng metformin, hindi nagbabago yung timbang nila. Pa-ilan-ilan, medyo gumagaan sila. So, hindi siya effective. Kasi ang question mo is, wala siyang diabetes, pero gusto niyang pumayat, pwede mag-metformin. It's not an effective way of losing weight.
At sige question ko, siguro applicable to katsoy longzong ko. Doka, kasi atsoy lang le daya in kay kila. Sinchudik yo di pilang bekigyam hui, di ba? Bekyam itang lo, high blood, longzong cholesterol lo. Tongsyo ko si 2 days before de dieta. Asin sila before dieta. Para ige laboratory result ay kang lolay. Sige, tiyo ah.
Sige, actually, let's talk on it. So, question is, people will behave when it's time to get a blood test, right? So that pagdating ng doktor, galing-galing mo, ang bait-bait mo, di ba? The problem is, meron kaming special test that will average your sugar sa nakaraang 3 buwan. Iwan ang piyang kundi lobe sa koge etanga. Okay? So iwan na 2 your patients, yung sugar niya sa umaga, fasting maganda. Pero yung 3-month average niya mataas. 2 lang yan. Okay? Yung nakaraang 3 buwan, hindi siya sumusunod sa diet tsaka gamot. 1 week before, alam niya yung blood test, doon lang siya nag-discipline. Kasi yung fasting sugar, yan yung sugar niya nung kinukunan siya ng dugo. Pero ibuhat ng daya, kasi kuno ng diyam, sako, piangkun, no? Okay? Or the other reason is, unya itang zaki ko, kake ko, tansi epo, takay si jia o, zong tiao ya kui ko, and then, sako, piangkun tayo si kui, no? So, pero yao zui pinangan eh, di kaya nga sa, ya tiyo, cho lang eh. Zui
Last 2 question kasi nanaklan ako, third topic pa. Sige question yung yaw ko. Chitsun panahon ko, sige diabetes ko, for sure, dati may kong si genetic acquired, dati laupe-laubo ang kong ama. Pero chitsun, kasi kwa si radio ko, yatswe lang, let's say gun ko, yatswe lang hemodialysis no la. So, we pa yung nakita, wak yung classmate. So, chitsun si Chaya Chwede diabetic ko si because of lifestyle, katsoy, as imsiya.
It remains, katatang European ibo, waktsue ko, kasi ilan dya, China. Diabetes was not very prevalent. Hisi, tang iyabe kaiwa si zon ko, tang European si waktsue. Nang tayang kong se aju lang ya gao tang European. Pero tayo bo ya tsue. 一開花嘅時陣個，見打去入去麥當勞入去個，糖尿病仲有病。So it's the genes was there to begin with, and because people on the other end are not eating too well back then, about maybe 30 years ago, diabetes was not prevalent. So it's mixed. Okay, so we have modifiable and non-modifiable. So yes, weight. My youngest type 2 diabetic, which is supposed to be above 20, 不係 type 2，伊爸母上糖尿病個，一隻矮仔肥哦，不係最出得嘅糖尿病，唔是第一期的啊，type 2。They are getting younger, and people get dialysis because they don't take care of their diabetes, or they get diagnosed really late.
And then my last question ko, na thông常di ay chạy sige lang ni kay si ni u diabetic lo ko, wa thông常si ni kwa lang ka. In Lex, in its ta ko, right? Thông常ule otiam.
Yes.
Higit to sila start u diabetic lo ba?
Yes, again, si start again
Meron na.
medyo late
late
sign
na.
yan. It's a sign of poor perfusion to the skin. So her question is, yung pigmentations, yung pangit, yung mga may batik-batik, hindi yan risk factor for putol. Ang putol yung umiitim yung paa ito, pangit lang tignan. Sinyalis ba ng diabetes yun? The answer is yes. Then those two should be checked for diabetes.
Okay, din nakuha din ni ka bo sui lo ko ule o ko din tagay jam din ni ka. So si din ni kay si u diabetic lo. So lani si ka din jam si an cha tian ko kasi lani sa guest speaker ko after Dr. Christian Ang Kho ina ko itiam le pa. So lana si lani third guest naman lo.
Thank you.